to the Mutton Magic, and today we are gonna dive into a very hard and the most difficult part of the residency or the fellowship, and which is research. Of course, everyone knows that. So today we are gonna start with the very simple research, that is a case report or case series, and then we will discuss what are the research methodology. For example, what are the case report and how you can do it, how you can review the literature. And then we will discuss what are the different kind of research, like what is the meta-analysis, what is the systemic review, and what are the cohort, prospective, retrospective, everything. But let's start with a very simple topic, which is the case report or case series. Do not start with the meta-analysis because that is a very complex topic of the research. First, start with the case report. You should write a case report for yourself, and then you can get a help from the mentor, and then you can start from the other research like the systemic review, meta-analysis, cohort. So the sequence, what you should start from the case report, and then you can write some case series as well, and then you can pick a topic of case control study, which is very easy, right? If you are working in a hospital, and then you can start with the cohort study and followed by the systemic review or meta-analysis. So let's dive into the case report. So what is the case report? So case report is a detailed report of the diagnosis, treatment, and follow-up of an individual patient, and it should be different, it should be unique from the other case, right? Because it's a case report. If you have, like, if there are many case report, if you're writing the same thing that is already present in the literature, then gonna not be accepted in the journal. Because the case report, one of the criteria, it should be different, it should be unique, and should be detailed, right? So this is the definition. So the first thing is, how would you differentiate case report from the case series? So case report, if you're writing a one detailed diagnosis, treatment, follow-up, or any kind of things regarding only one patient, then it would be case report. And if you're writing more than one, then it should be then you can call it a case series, right? So let's start with the case report. So how you can write. So we will discuss everything about the case report. So after watching this video, you would be able to write a case report from your own. So just hang on. So let's start the case report first. The first thing, you need a topic. So how would you choose a topic? For example, if you are working in a hospital, you found a very interesting case. For example, the case of TB, for example, the case of Tacos Turbo, or any case that is kind of little different. So for that, you should have medical knowledge. Medical knowledge means you should have a very the sound knowledge of that topic. For example, if you're writing a case of tuberculosis, then you should have a sound knowledge of tuberculosis, because if you don't have a knowledge of tuberculosis, then you can't be able to differentiate this is a unique case or this is the same case that is continuously present in the hospital. So first thing, you should have the knowledge, and the second thing, you should pick a topic. So after picking, for example, let's suppose I'm picking a case of Tacos Turbo. So I'm just picking for example, incidence of pulmonary hypertension in the Tacos Turbo. For example, this is the very unique case. You never saw a case who, the patient who have a pulmonary hypertension with the Tacos Turbo. For example, if patient have the Tacos Turbo and you check the pulmonary blood pressure, which is raised, so you can call it a pulmonary hypertension. So you are checking the pulmonary hypertension in a Tacos Turbo. So this is a very unique case. So this is the case, and what should be the next step? So next step always be a literature review. So whenever you are doing research, and so any kind of research, case report, case series, the meta-analysis, you need to review your literature. This is very, very important. So the next question is, where and how would you review the literature? So for literature review, you have many options. The first most important one is the PubMed. So just go to the PubMed and write a topic. For example, I'm going to write incidence of pulmonary hypertension in a Docustobo, and then I would pick, there is a portion of meta-analysis, case report, case series. So I would pick the case report. So whatever the case report already presented on that topic would be pop up on that window. Then I would read all those cases, and then I would found, is there any real difference, or that the same case has already been present. Then I would just won't be select that topic, because the criteria of case report would be the unique, and it should be very unique. Like if there is a subtle difference, you can write it. Like for example, already patient have the pulmonary hypertension, and now you have a patient who have the kind of some right-sided heart failure symptoms with pulmonary hypertension in the Docustobo patient. Then you can write it. So literature review is very important. So I will show how you can review the literature. Hang on. And after that, you should review all the case series and differentiate whether it's a new case or it's the same case that already been present. Then talk to your expert or the mentor. You should have a mentor. Without mentor, you won't be able to research. For the research, you need a good mentor. So find a mentor first, then start researching. Without mentor, it's like very difficult to do a research. For example, you select a topic and you review the literature and you differentiate, and you came up with a topic that is like very unique, and now you wanna start writing. So how you can write? So these are the sequence, like how would you start and how you would end the case report writing. But before diving into that, the writing part of the case report, I wanna show you how you can select the topic and how you can review the literature review. So this one is a case report on the transverse myelitis following a novel coronavirus infection. So you should read like at least 10 to 15 case report on a particular topic. For example, if you are doing writing a case report on the transverse myelitis among novel coronavirus infection, then you should read the all literature. So this is the example of case report on transverse myelitis in a coronavirus infection. So you can see, so they always say, more you're gonna read, more you know. And this is also true for the research. If you wanna really be a researcher, like a good researcher, then review literature. Like if you don't have a knowledge of literature review, then you're gonna be you won't be able to differentiate the new topic with already research. Like you should have whenever you have free time, just go to the PubMed or Sci-Hub or whatever the resources that you have. Just read case report, case series, and observe how the writer have written. So you can here observe, like this is the abstract, so this is the case report, so how the researcher have write this one, right? So first is the abstract, and the abstract he have written the introduction, case report, and the conclusion. And then he have write the introduction, case report, and the discussion, and at the end he wrote the conclusion. At the end he is just given all the references. These are the guidelines for case report. So case report abstract should be like 200 to 250. It should not be more than 250. If it is more than 250, they won't accept your case report. So abstract should be 250. You can write the abstract without the heading, and even you can write the abstract with the introduction, background, and conclusion, right? So you have two options. You can write the abstract with the heading, like the background, introduction, and conclusion, or you can write the abstract just without the background, without the headings. And the introduction should be 200, and then there comes a very important part of the case report, that is the case presentation. So you would write, right, case presentation. This was that the old age patient and present with this, and we did this test and we found this imaging, and we make a diagnosis on the basis of diagnostic criteria, and then we treat it and we follow the patient, and what we have found was this, and this is how it was unique to other previous cases, right? So that's how you can write the case presentation. And then it's the treatment. like all the things that you have written, and then you can discuss. So in discussion part you can write, so this is the case of this one, and in the literature review you have found this one, and you can write in this case already present some cases already present with this and this, and our case was unique in that the particular part. And in the conclusion, at the last, in the conclusion you can write whatever the conclusion is. And the fourth reporting part of case reports are conclusion, abstract, case presentation, and introduction. These are the major part of the case report. For example, if I am the doctor and I wanna read some case reports, so I would go to the abstract and conclusion part, nothing else, right? But if I have a time, I can read the case presentation if it is interesting. And so main thing is the observation. If you are a good observer, you can learn from the others, like how they have written the case report. Let's see. So here you read the abstract. So let's see how he have written the abstract. So this is during the coronavirus disease and emergency providers are not only seeing an increasing number of patients with the COVID-19 infection, but also associated complications sequel of the viral illnesses. So here just wrote the introduction. See, so what was the topic? So topic was transverse myelitis in the coronavirus infection. So this is actually a kind of complication of coronavirus infection. So he have write the introduction with the COVID-19, and at the end he wrote something about the complication, because the major thing that he was wanted to highlight was the complication. So here just write like one line of complication as well. And the case report, he just wrote the case report like 3 lines of case report. So we present the case of 28 years old female patient who presented after a confirmed COVID-19 infection with lower back pain, bilateral systemic upper and lower extremity numbness, urinary retention, and the patient was diagnosed with acute transverse myelitis. She required intravenous corticosteroid plasma exchange with a significant improvement in symptoms and minimal residual effect. So this was the introduction and this was the case report. And the conclusion, what he wrote, this case illustrates the importance of prompt recognition in the treatment of sequel of COVID-19 infection. If you have a data of COVID-19 patient, then it's a very easy to write a case report, because conclusion is very easy. You can write something like that, right? So this is the writer have said that the importance of diagnosis of COVID-19 is very important, because COVID-19 patient can develop any complication. No, this is like, I would say this is the base topic. You can choose it, right? If you just need data, if you have a data, go for it. The kind of, because this the COVID-19 has been a new case and there are many complications, so you have many opportunity to write a case report on that. In the introduction, so this is like the abstract, and then he wrote the introduction. So introduction, he said like the coronavirus is having significant mortality and morbidity and 2 million of cases. So here what he wrote something about the coronavirus. So you can do the same thing. You can write the prevalence of that particular disease and how the case is present, and how it is changing in that particular time, and how it affecting, like the coronavirus affecting the respiratory illness with the common symptoms like this, and also like in the pandemic the complications have been increasing. So this is just a kind of introduction. You can write the introduction very easily. And the case report, this is very important part of the case report, because this is the case that you want to write. For example, he wrote 28 years old female with a history of hypothyroidism or levothyroxine developed symptom of protective cough. So this is how he have wrote. You should start from the scratch, right? You should take the detailed history of that patient if you're writing the case report, and then you took a detailed history, and you should start from the scratch like this. The writer have started. So this patient has the hypothyroidism and he was taking levothyroxine and he developed some cough, right, and low grade temperature and low back pain, myalgia, rhinorrhea during the novel corona pandemic. Right? She tested positive for COVID-19 via at home swab test, and then he went to the primary doctor, her upper respiratory symptoms resolved in the next week, but lumbosacral back pain persisted and worsened, although without radiation. In addition, she developed paresthesiasis in lower extremity, which progressed to total loss of sensation with the ascension of symptoms up to her mid chest below the nipple line and bilateral upper extremities as well. It's a nominee. So this is all presentation of sort of like how the smart writer was. He started with a sequence like how the symptoms are started and how it is goes. Like first patient developed the coronavirus symptoms and then he developed the transverse myelitis symptoms, right? And then he was diagnosed with the and what and let's say what they did. And the patient's neurology exam was notable for symmetric decrease in sensation below the fifth or sixth vertebral. So this is the symmetric, right? So symmetric always tells you what? They always tells you the transverse myelitis because, and that is the important, that medical knowledge is very important. So transverse myelitis patient always present bilaterally and should be symmetrically, and patient should have some urinary problems like. So this patient is symmetric and 2-point discrimination also lost. She experienced decreased proprioception, everything. And then how they evaluate the patient, they did all the lab and then find this and this, and at the last they have diagnosis diagnosis transverse myelitis, and then started the treatment, and after that patient was responding. So at the end what they are saying, like if you read this and then they have write the discussion. So the discussion is very important. So discussion, you should write discussion related to the transverse myelitis, like this is a very acquired neurology condition and this can affect spinal cord. You can do the MRI and you can find the lesion and then in the spinal cord, and it is followed by some respiratory infection like the like patient can present of the TB. I have saw some patient who present with the transverse myelitis after the tuberculosis, and he was died at the age of 66. And so this is how. So in the discussion is very easy. Just go and read the transverse myelitis topic, and you can write all the the relevant and pertinent information of transverse myelitis, right? And at the end, conclusion is very important. So let's observe what is the conclusion and how writer have write this conclusion. So as the number of COVID-19 infection continue to rise, more patients are presenting to the emergency department with novel coronavirus related symptoms and associated complication. Healthcare workers, especially emergency provider on the front line, treat these affected patients and near witness to the different presentation and the clinical courses. This case report emphasizes the importance of remaining cognizant of atypical and less prevalent sequelae of viral infection in patients with the recent coronavirus, as a prompt recognition and management are important. So how very easy to write a conclusion, right? So this here writer is saying like COVID-19 can present with the multiple complication, right? So you should be able to diagnose those patient who have the COVID-19, and you should check all the relevant lab values and these things. The conclusion here is like whenever COVID patient present, you should be able to anticipate like what would be the complication, and you should treat COVID-19 before it develop the complication. This was the conclusion. So how this was very easy. And if you wanna read other case reports, so just go to the Google and write a case report, right? So case report, so you can write a case report on transverse myelitis, right? You just go and you can write, and here are the some case report. Yeah, so this is a case of transverse myelitis in a mildly symptomatic patient, an emerging and a serious neurologic manifestation of COVID-19. So this is how again the case of case report of transverse myelitis. So here you should observe, you should read the literature whenever you have a time. Read literature, read review. This is the most important advice that I would say. If you want to dive into the research, for example, if you want to do the fellowship or you want to be a good researcher, then review the literature and observe, review, read and observe how the literature, like how the writer have written the case case report. If you observe, then you can understand how to write a case report, how to write a case series, and how to write a cohort, how to write a meta-analysis, right? So let's read another case report. So this is the abstract. I already told you, abstract, you have a two option. You can write abstract just a simple, or you can write a case, the abstract with these part. Like, you can give the heading like the introduction, case report, and conclusion. I would say this is the better one, because it gives you a sense when someone is reading, right? If I'm reading, then I can read the case report directly. But this is also good. You have the leniency, you can write everything. So coronavirus disease, this one is known to have neurologic manifestation, and one of them is acute transverse myelitis. So observe how the abstract writing is different between two case report, right? Here he have just started the complication. He started from the complication, despite being accidentally rare. So it's rare. So he have just rare, read the literature review, and he have found that it's a rare. The complications are rare, and this is the like 1.34 to 4.6 cases per millions a year. COVID-19 associated with ATM causes have continuously been reported and have significantly health impact on patients. This case report present a previously healthy, unvaccinated male who developed COVID-19 ATM. So compare and contrast the abstract. So let's see. This, the person, this is the writer have written like the introduction. This is the introduction and can present the sequel, and this is the case report and this conclusion. So there is a no specific guidelines of what to write, but it should be the very relevant to the particular topic. So here he wrote the introduction, then case report, and then the conclusion. But what he started from the complication, and then he wrote the incidents as well, and then he have wrote like they are like what they are doing. They are reporting a case which is unvaccinated and COVID-19 who developed the acute transverse myelitis, right? And then he have wrote the introduction. So let's read the introduction as well. Yeah, so then in the introduction, he have wrote the coronavirus disease due to severe acute respiratory syndrome. So this COVID-19 disease is caused by this virus. Since its first emergence in Wuhan City, China in December 2019, has continuously become a major issue in global pandemic. So here just write the sequence like how the COVID is starting, and more variants have emergence with increasing virulence, and cases have reached over 300 million. So this writer have read the literature very well, and he have write the incidence as well as the prevalence with this. And COVID-19 is known to have neurologic manifestations such as acute cerebrovascular diseases, impaired consciousness, skeletal muscle injury. So these are the targeted organ of the COVID-19. In a retrospective study performed in Wuhan 2019, it was seen that more neurologic manifestations were found in a group with a severe infection. So how he wrote? So he have just read the literature, and he just write, he have also give the reference. So this is the way you can review. If you want to review this reference, just click here. So this is the study, like this one is a different study, neurologic manifestation hospitalized patient with the coronavirus disease, right? So you can write this one. So you have an option, so you can write this one. So this, I would say this study is better. This writer have the good way of writing, because it also give the references. Yeah, so you can read the reference as well. And there is no experimental data so far that is able to elucidate the exact mechanism of COVID-19 in the nervous system. So he also said there is a exact mechanism we don't know still, but there are some researches has been going on. And it is important to note that COVID-19 is not a neurotropic virus, although it does blind the angiotensin this receptor, which can also be found in the glial cell and neuron. So this is where he write. He also started from the scratch, like how the COVID-19 has started, and what is the prevalence and what is the incidence, right? And then he also started the pathophysiology of COVID-19, and he also said the COVID-19, how the COVID-19 can affect and what is the mechanism, right? So he had given that information as well. So I would say this introduction is very right. So you can what you can extract information from here. So you can extract something like that. So whenever you need to write introduction of any case report, so keep in mind what you can write. Just write the incidents, right? You can write, the how the diseases have started, what is the incidence, what is the prevalence, and what is the pathophysiology, and what are the treatment, and what would be the the possible complications. So this is also here, right? The something, and also something right about the transverse myelitis. So here write something about this one, so that you can explain the transverse myelitis bit in the introduction part as well. So one, that you can write incidence, prevalence, the how the presentation as well, and you can write the pathophysiology as well. So these are the portion that you can write in the introduction. And the case report is presentation is very easy. You should start. So let's suppose and that the previous writer started from where? So he started from the screen. Like he told us that the patient started from the the patient was taking a levothyroxine for hypothyroidism, and then it is starting, right? How it can start, how it was started. It was started that the patient was taking levothyroxine, and then he developed some kind of chest symptom, and then he presented to primary care physician, where he was diagnosed with the COVID-19. And after that, they treated that particular patient and sent patient home. And when patient came for follow-up, her symptoms like her back pain and all those symptoms of transverse myelitis become worse. But let's see how this writer have written. So this is a 70 years old, previously healthy, unvaccinated male present with a 2 days history of numbness on both of his legs from the waist down that made it difficult from his home. So he have written, he have started from you should write something about the patient, like whether patient was unvaccinated, or patient is old age, or patient have the comorbidities. You can write from that as well. And he did not have any fever or chills. However, he did complain of mild headache. Symptoms initially started on his feet that progressed upward. He had flu-like illness 2 weeks before the symptoms started and tested positive for COVID-19 via PCR. And physical exam shows, so this is very very important, right? This is, I would say, this is the most important part. Sometime if you're writing the case report, you have a complete the confusion. So what should I start with? And sometimes patient have something, the if you are writing, for example, you can think like whether I'm writing it's in a correct, if I'm whether I'm doing any kind of mistake. So there is no specific rule. You can write it from you can start it like this, like patient present with this to this, or you can write from the script like patient present with this, and he was doing this, and then he developed this, and we did this, he was diagnosed with that, and we started on that treatment, and for follow-up we found this one, right? So he have write the case presentation like this. He presented to a community hospital initially, and he wrote from the script, like, and then they did the MRI. And the MRI, they found the MRI was normal at the first, and then they did all the tests, and in the end they have diagnosed the transverse myelitis, and then they have started the treatment like the physical therapy, all those, and patient not receive any treatment, and patient was responded, right? And the discussion, you can write various neurology complications. In the discussion, you can write anything about the COVID-19, like the previous writer have written, right? So in the discussion, you can write anything about the but it should be related to your case. Like this is the how COVID patient can present with a neurology complication. COVID-19 is can cause this and this, and this is how the pathophysiology, and this is the treatment, and what are the body's response toward the COVID-19. And he also you can write some the case report, like the previous case report, if they are relevant to your cases. And in the end, what he have learned. So conclusion is very very important. So let's see. So ATM in COVID-19 is not uncommon neurology complication. So our the previous writer wrote, like the complication could be anything. You should follow or diagnose COVID-19 as early as much you can. But here you have started like ATM is the COVID-19. It's uncommon. Like the complication could be anything. This is like the same way, right? It is still unclear if it is a marker of severe COVID-19, since it has happened in both severe and milder cases. Clinician should access any neurologic complaint, like the complaint presented by patient with the COVID-19. So you should, this is the same thing, right? This is like another way of writing the same thing. So again, he is saying whenever patient, suspecting the COVID, make sure you should diagnose it earlier as much as you can, before developing the complication. So this is the good topic. You can write many case report on the COVID-19 if you have a data. And so this was the case report. So let's see what is the sequence. So this was the sequence, right? So abstract, then the introduction, and the case presentation. You can write the presentation, physical examination finding, like what you have done and what you have found, and then like what are the tests that you have done, what the test came negative and what test came positive. And imaging, you should give some kind of imaging because it looks better. A diagnostic criteria, you can write a diagnostic criteria, like this is a diagnostic criteria, and on the basis of that we have diagnosed this patient, and this is a treatment, like you have started the corticosteroid and then you follow up the patient whether the patient responded or not. You should write everything about that particular patient, and discussion we just did and conclusion we just did. But this is a very very easy case, the research that you can start with. I would say start with the case report, and then you can go further and you can write the case, case series, and then cohort, case control, and meta-analysis. Sometimes you are, very, the fidgety to write, meta-analysis at once. This is not the way you do it, right? Because meta-analysis is very very difficult. Sometimes, if you have a bad time, so you are fidget, you can start writing the meta-analysis. This is not the way you do it. Research writing takes time. It takes years. It may takes like 1 year or 2 years to become, the very good at the research. So start from the scratch, write a case series first, a case report, and then go hard, case control, you can meta-analysis, or you can write, systemic review. This is how you can write it, right? So let's meet another video in the next session, and that would be like also would be based on the research as well. So see you, bye, and see you in the next video.